actually looked in the mirror maybe 3 years ago.
Okay.
And I realized my left side of my hip pops out more than my right. And
When you say it pops out, it appears to be sticking out more?
Yeah,
okay.
so my right side is flat and there was a lump on this side. So I don't think I had any issues. I didn't feel anything.
Okay.
But just looking at it and knowing it was there and it wasn't even,
okay.
over time it started affecting me. And then I started thinking it's messing with my...
What do you mean it started affecting you? So knowing that there was a discrepancy maybe in the hips or the leg length,
yeah.
knowing that, you started to feel the symptoms.
It was always in my head, and then now when I start doing long runs, now I know it's affecting me.
Got
my
it,
knees, my ankles.
Mechanically, it's affecting you.
Yeah.
Okay, and where are you feeling it the most?
Probably my hips. After runs, hips.
Okay.
My knees always ache.
Both sides, one side.
I'd say it's more one side more than the other, but it's kind of all the lower back down to my knees. Also, I have upper neck pain.
Okay. Now let's go back to the knees and the feet. When you're running, are you running or jogging?
Both.
Okay. Jogging is probably not indicated right now.
Okay.
If you're doing a 9-minute mile or faster, no issue. You want to do intervals where you're doing sprints, or you're doing like a 1-minute sprint, 2-minute walk, 1-minute sprint, 2-minute walk, right? Something like that. You'll get the cardio effect of it just for right now.
Okay.
Just for right now.
Okay. Got it.
Because once I go over stuff and explain to you, if we're trying to fix something and go through a process, we don't want to add variables that are going to mess it up.
Okay.
Okay?
Okay.
Fair enough, because you're driving all the way out.
Yeah.
All right, so starts at the hips. You feel it in the knees. You feel it in your toes at all?
No pain in the toes. I think
Okay.
numbness sometimes.
Okay.
Tingly, cold.
Okay. Both sides, one side more?
I think both.
Okay, what else?
As far as down here, that's basically it. I think I know one of my legs is shorter than the other at times.
Okay.
And then other than that, it's my upper,
Tell me
my
about
neck.
the upper. Tell me about the
Always
neck.
have pain on the
Since when?
right side. Years now.
Since you can remember?
Yeah. And then I was playing basketball maybe 4 months ago. Reached down, felt like I had a cramp, and since then I feel like it's just hasn't been the same.
Right side. More?
Right side,
Right
yes.
side. Okay.
And then, but I get pain on my left scapula. I feel like that's where I get a pinching feeling.
Left scapula.
Left side.
Underneath the wing bone, top of the wing bone, bottom of the wing bone, underneath it.
So I feel it, I can't find it.
Okay.
I just sit there for days.
And you feel it more when?
At any time. It's just
You feeling it
when
now?
it kicks in, when it flares up. No, not right now.
You're not
Right now it's my right side
Your right side.
and my neck region.
Okay. So hips, knees, we'll figure out the pelvis, the foundation, neck, what else?
I'm always cracking everything.
Okay.
I crack my elbows, but I crack everything. But other than that, it's just my hip. That's keeping me from working out.
The hip.
That's keeping me
That's
from working
number
out.
one.
This is every day at a desk.
Okay.
Just the pain is always there.
Activities and sports you used to play. What sports did you play?
Basketball.
All basketball?
All basketball.
High school?
Yeah, growing up.
Growing up, okay. And right now you want to play obviously still?
Yeah, I don't have time to play so much, but I do.
Okay.
We do go to the gym, work out,
Okay.
things like that. I was running for a race, and I was running about 9 miles a day. Well, not a day, maybe per day when I was training, and I had to stop 2 weeks ago because the pain was so
hip.
bad, so I couldn't do the race. Yeah.
When's the race? Or it's
It
done?
was the 20th.
When's the next one?
I was waiting to see you.
Nice.
See if we can
Let's
fix
see
it.
what we can do.
Yeah.
Okay, cool.
Yeah.
All right. Anything else I need to know?
No. That's it.
Okay. 248, 236. 248 on the left, 236 on the right. 66 here, 70 on this side, right? This is the pelvis, this is the sacrum. This constitutes the foundation here. Now, when we're looking at the numbers, when we look at the side of the pelvis, it sits kind of on an angle. That's the acetabulum, and that's where the femur sits in. Yep? Now, when it misaligns posterior, I'm referencing here to here. It goes posterior, inferior. It's going to project longer, a larger number. If it misaligns forward, it's going to project smaller. So if we look here, what do we see? This is actually projecting what?
A smaller number.
This is a smaller number, okay? This is a bigger number. So what that means is this is what's misleading that we need to actually figure out. 236, 248. So your right pelvis actually misaligns up, okay? The difference between 36 and 48 is 12 millimeters. So it's misaligned up 12, or you can say the left one is misaligned down 12, one or the other, right?
Yeah.
It's one or the other. Here's the kicker on your case. If I fix this pelvis, I'm going to make that bigger. If I fix this pelvis, I'm going to make that bigger. Think about it. If this is misaligned up, I start bringing it down, it's going to bring this down. There's a rule that Dr. Gonstead came up with in the analysis. It's a 5-2 rule. For every 5 millimeters of misalignment of the pelvis, it will change the femur head by 2 millimeters. What that means is, conversely, if we correct 5 millimeters of the pelvis, it will change it 2 millimeters. Now, if this was the large number on this side, and there was a difference of 12 times 0.4, 4.8, 5 millimeters, we'd be able to fix what? Follow my thought process. So if this was the larger number on this side, we'd be pushing it up.
Mm-hmm.
If this was the small number on this side, we'd be pushing it down. Whichever way we go, it's going to bring this one up. That's not your case. If I work on this pelvis, it makes it worse. If I work on this pelvis, it makes it worse. So what does that tell us? The answer is in here somewhere, in the sacrum.
Really?
There's a big tilt in your sacrum, number one. Number two, you're going to need a heel lift. You're going to need a heel lift, okay? It has to be what Gonstead found in all this, on all the exams and research. It should be under 7 millimeters. Under 7, adjustments will hold, no issue.
Okay.
So we want to get that to 7. Does that make sense?
Yeah.
Okay. That's kind of important, and I'm kind of true because I'm getting a lot of these cases where none of this is textbook. Because if we follow textbook, I can't touch this. Okay, because you get my thought process. You get what I'm saying, right? So that's the first piece that we have to address is your foundation, and that's going to be more than half of the answer. Whether is it this. Now, 66 and 70, this line is bigger, this one is smaller. Now let's put it together. The sacrum is rotated on this right side. So if this is the center, when it rotates one side or the other, it's going to project wider. So we're getting a rotated sacrum on the side of we call this an AS ilium or ASIN ilium. And what that means, if we're looking at this, that if we have a sacrum and a pelvis issue on the same side, we're going to determine based on the leg check where we're going to start. It's probably going to be in the sacrum. Okay. So here's the interesting part. With the foundation being like that and that leg length inequality on the right side, you would expect a right convex curve. You would expect the curve to do this. So whatever's happening, your body is holding well, whatever's going on. So that's your activity levels that you've been. Okay. It should look like this. It should be bent. It should be curved.
Extending with the...
It should be curving with it, so I don't like it's not a scoliosis, it's a lateral curvature. That's what I should see. I don't know why I don't. Again, they're just pieces we're going to figure out. We're just figuring it out today. That's it. We just got to figure it out. Okay. Now, let's go up. The next step, the next phase, or the next thing we need to look at is what happened here. There's a nice kink to the left. And it's starting at T1, T2, T3, T4, T5, T6, T7, T8, as far down as T8, down around here. So it starts right around there somewhere. And it goes up. And then the third thing I'm seeing is up here. For the neck. Okay, before we get to the lateral neck, we can see these kind of, it's a little jaggedy through here. They're kind of shifting off to the side. So from here, right to right there, that one rides up, that one rides up. So this is a T3. T3, T8, L5 sacrum, and the pelvis is so far what we need to address. Now let's look at the lateral. You following me so far?
Yes.
Am I boring you yet?
No, definitely not.
Okay. Am I boring you yet?
No.
Okay, let's keep going. Okay. So, you've watched films, you've probably heard me talk about 60-degree curves.
Mhm.
Yeah? And we're designed to have 60-degree reciprocating curves. So if we look at yours right now, you don't have the curve.
Oh,
You need more curve. But
Okay.
the good news is this, you got fantastic discs.
all right.
Your discs are great. Your L5 disc is great.
Okay.
So even you've been running, I'm assuming you have been running
Mhm.
fast because you didn't damage anything down there. So that's good news. That's
Okay.
good. 4 is great. 3 starts to see some circle patterns. You see that?
Mm-hmm.
And that's only because of the slight curve in the back. So what we're looking at are the undersurfaces of the bone. So if it's curved, right? When you go like this, you start to see underneath the bone.
Okay.
So on the
Oh,
lateral
good.
film, it may look bad, but it's not. It's just because of the curve.
Okay.
That's what I meant. That disc is just like that, and that is just because it's bent.
Okay.
That's it. All right. Old compression stuff mid-back, but discs are great all the way through. I'm over here, by the way. I'm here, I'm here, I'm here. It's a little thinner in here. That's around that mid-back again. You
Mhm.
took a lot of stuff here. What position did you play in basketball?
Like forward, I've been this height since I was a kid, so I was played against the bigger guys. So just a
Okay.
lot of pushing.
That's what- but-
because I was not as tall, but
Okay.
yeah, forward.
So you played well. You
Sorry,
played
I used to play a lot. Yeah.
All right. Okay. Now let's get to this part here, right? Now when we look here, you're talking about your neck. You have a nice level disc here. This is C2, 3, 4, 5, 6, 7. 7 is level. 6 is tilting slightly. Okay, and then 5. You can see 5's disc is actually thicker than 6 at the moment, right? But what's happening here, we have what we call a congenital fusion of C3 and C4. It is a normal variant. It isn't something that happened to you by trauma. It's not a trauma thing.
Okay.
And the finding is the wasp waist appearance, where it starts to go like this. We call it the butterfly vertebrae. And why that's going to be important, it's a good thing you've never had x-rays, have you?
At one place.
Of your neck?
Yes.
And no one ever mentioned
He
that to
didn't
you?
show it to me. No, I never went back.
Okay, so this is important, and the reason it's important is it's congenital. It's a good thing, because if I started to feel an it hurt there, or anyone feels and starts adjusting your C3 over your C4, it's not a good thing.
Oh.
Okay? It's not a good thing at all. Now, what does that mean for us? What it means for us is, if we get a C4, it's fine, we can deal with it. If we get a C2, we can deal with it. We better not get anything at C3. I don't expect we will anyway, okay? And down the road, flexibility becomes very important for you. Flexibility, okay? You do your strength training, you do your sports, you do all that, but you'll need some sort of stretching. So those are all the fun things I see on your film at the moment, but all that means nothing without examining you and finding it on you. So the next thing, any questions so far? Anything I've gone over?
Well, just how does that happen? How does
what happen?
Why is everything on the line misaligned like that?
That's a
what did I
good
do?
question. I don't know what you did here, but if we look at your lateral film, we'll get a couple of answers. Now, let's go back to here, okay? So you don't follow a very specific trauma pattern, so to speak. It's just wear and tear body.
Okay.
You've gone through stuff, right? As we're going, let me go over here. This misalignment of 12 millimeters, you see I measured it different, okay? So there is 2 components. It's not just an up and down misalignment. There's a lot of rotational misalignment. And this is what I need you to see. Let's say, before we get into why and how, the femur sits in here. Femur is part of the knee, right? And the hip. So if you just put your like knuckles in there. Just put your knuckles in there, okay? Now, that's how, let's say that's normal. Bring your elbow down. Okay, let's say that's normal. Okay? Now, your pelvis is doing this. What's it going to do to your hip? It's going to pop out.
Pop out, yeah.
I'm giving you your answer.
Yeah.
It's going to pop out.
All
You get it?
Yeah.
If it was like this, what would it do? Possibly still pop out.
Yeah, just forward more.
Right?
Yeah.
So do you see mechanically now? Close your eyes for just a sec. Feel that's your hip. Okay? Just feel that's your hip. And this is how it's gone. And now you're running.
Mm-hmm.
Okay?
Yeah, I feel that.
Okay? And do you understand now the mechanics
Yeah.
of that? So the fix is your pelvis
Mhm.
and your sacrum. That's what we need to figure out today. All right. Walk for us, please. Back and forth several times. Start. Now, when you're looking at those dots, okay, what I want you to notice is this. These are the dimples, part of the SI joint. They should be moving up and down. The pelvis moves like this. So let's see what his dimples do when he walks. And you're gonna just walk several times. Do you see what's happening? They're not even moving.
Mm-hmm.
Can you tell him, please? They're not moving.
Not moving.
Keep walking. So it's interesting. It looks like the right pelvis is high, okay? And it looks like the left pelvis rotates out, just like I was saying. It's like this. That's what it looks like. Excuse me. Do you see that, what I'm talking about?
Mm-hmm.
Yeah? You want to go on the other side and get him from there?
Yeah.
Stop there, please, and march in place. Close your eyes and keep marching. Watch his feet now, please. The right one keeps pronating in a lot more than the left one. Raise your gown just a little so I can see your knees. Keep marching. Yeah, your whole left is rotated. Stop. Okay. This is what's interesting. Okay. So we have pronation both sides. We have more pronation on the right foot. But we have rotation here as well. Tender there?
Yeah.
How about here? Not as bad.
No, not as bad as.
So
Yeah, definitely. not
we
as
have
bad.
some a tibial rotation as well. So what I'm seeing here is these are both rotated.
Okay.
If they're both rotated,
Yeah.
pelvis. Have a seat, please. Let's get started. Okay, overall appearance. There's no curve here. The curve's the wrong way, and then it dishes in. He should be sitting like this, which you can't even get to at the moment yet. Okay, go back to your normal posture. Okay, so no curve here, dishes in there. A little higher on the right side, up and lateral on the right wing bone. Where was that wing bone pain you were talking about?
This, like here, somewhere in there.
Somewhere in there?
I just never know where it
Okay.
came from.
Well, I'm gonna suspect something is hiding up in here because we're gonna check out for you. Okay, now scoot forward. Let's check the movement of the pelvis first. Okay, open and close, feet touching, open and close the knees. So I'm on the SI joints, right side only. So you see what happens when he does the right? This whole thing is shifting. Do the left side only. When he does the left, the right shifts also, but it's not the same.
Yeah.
Do the right side. This whole thing is shifting. Yeah? Now, tender right there.
Yeah.
More tender here or here.
Lower, I think.
Yeah.
Yeah.
Right there. I mean, you can feel it, just one big knot right there. Okay, let's run the meter on the back. Let's see what we find. Scoot back for me, please. I'll probably mess up your hair. Okay, you're all right.
That's fine. Yeah.
Come see the meter closer. Let me see this. So we're running the meter now on the back. We're looking for inflammation on the nerve root. And the first one we're getting is actually that C4. Interesting. So it's the bottom part of the wasp waist, yeah?
Okay.
It's the bottom one.
Yeah.
So if we need to do it, would be okay, as long as you
Okay.
trust me to do it. Okay. Next reading is around 10. And nope. See how it's staying there the whole way?
Mm-hmm.
See that? That's cord pressure. So, I gotta change it all up again with you, sir. You're getting cord pressure from up here. So basically what's happening is the needle is sticking left side all the way down. I need to fix that first,
Okay.
and then do the exam.
Okay.
Okay, otherwise nothing is showing up here. Head down, please. Watch. That's 2, 3, 4. I need to be here. You feel that?
Yeah.
Okay. I need to do your C4. Let's do that first. Where do you want to see it from?
No, what do you
The
think?
front, maybe this here, the front, I guess. So we're doing C4. 3 and 4 is a congenital block. So we shouldn't have an issue with the 3. It's going to be very easy and light. There we go. Just a little movement. There you go. Walk it off once, come back, and then we'll get started. Now just that. Turn your head left, turn your head right. Should already be a little different. Smooth, right? Have a seat, please. All right, ma'am, come over here. Let's get to work now. Okay. So from that cleared the neck. Now the true reading should come out. There you go. T7, T8. And down at S2, S3. Okay. Back towards me. It's here, dude. It's S2, S3. All right. Let's statically palpate, head down. Let's check the rest of you. Watch my fingers. As I run my fingers down the spine, right about there, you start to get pooling edema, and it starts to go into the center, right there. Tender there?
Yeah.
How about that one?
Not as much as that.
That's the one.
Yeah.
1, 2, 3. Number 9. 9, S3. We already took care of C4. All right. And then we're going to check the pelvis. Let's do a leg check. I'm going to have you go face down. Let me put some paper there for you. Shifting. Now, what we want to check is the leg length. And it's going to determine if we're going to do the ilium or the rotated sacrum. Right? Tender there, yes?
Yeah.
Not as bad there.
No.
Okay, so let's check the right leg. It's the short leg as well. Now, it's shorter, you can see here from the top. Yes, come over here. You can see a little discrepancy there.
Mm-hmm.
Now, when we flex the knees to 90 degrees, if this stays shorter, it's sacrum. If it goes longer, it's pelvis. But we expect it to be shorter. And if you go from the front or behind me, you can see it. Okay? It's shorter. This is a sacrum issue major, sir.
Okay.
Sacrum T9. Stand up for me, walk it off, and tell me when you're ready. It's showtime. So let's put it together now. S3, cause a drop, part of the cause of your dropped hip.
Okay.
There's fixation of the pelvis as well, but that's not where we would start. Okay? T9 and C4. Those are your major nerve readings. Then I need to work on your right ankle today.
Okay.
Then I can tune up your shoulders, elbows, and wrists, no issue.
Okay.
Okay?
Got it.
That's my thought process. So, let's do.
Okay. Don't watch on Instagram.
I'm putting some exclusive ones on there.
All right.
Yeah.
All right.
It's called the Cobra.
Okay.
It's from my Trinidadian patient who came.
Oh.
So it's a funny video. Slide forward. And let's see what we're going to do for you. I'm probably actually going to do a push-pull because I need to get lots of oomph for you. Okay. So that's where we need to be, but I'm going to be way down low here, okay? You feel that?
Yeah.
Yes?
Definitely.
So we're going to be right down around S3, and I'm going to start it off here. There it is. Gotcha.
Oh my God.
Come on up. That wasn't the home run. That was the start. Walk, please, back and forth this way. Back and forth. You come over here. Check out his dimples after each adjustment, please, so we can see the changes. See how it's moving just a little bit now?
Mhm.
Should feel different, yeah?
Yeah, definitely feel.
Yeah. Still there, but it's a little different. Okay, let's go on the knee chest table, sir. What's your height?
5'10".
Okay, let's go over here. Let me get you set up first. You got carpooling and you got the video person. 2 for 1 today.
Yeah.
Gotta love it. Face down. No pun intended. Knees back. Drop the belly button down. There you go. Now, let's get the right positioning. Knees apart, please. Okay. Got a lot of flexibility, I'll give you that. Okay, I'm on the S3. I'm here. 1, 2, 3. To the right. Pisiform contact. Chin up, sir. Okay. Now remember, it's dropped on that side, so I need to torque it up, okay?
Mm-hmm.
To get that lift. That's what I'm saying. Stay there, please. Number 9. Drop the belly button. Oh, yeah! Come on up. Walk it off. That's the good stuff, sir. Keep walking. Tell us what's different, please.
I feel like there's air moving through my body.
Look at his feet. It's changing. It's pretty cool. Your pronation is reducing slightly, dude.
I feel like when I walk, I tilt to one side, or not right now. Normally, I'm running into my dog,
Yes.
and now I feel a little more stable.
Okay.
He used to blame it on the dog.
Well, you understand now it's the hip discrepancy.
Yeah.
Right? Let's go on the orange table, get a little more oomph
All right.
over here. Just a little bit. Okay. Wide platform. Face down. Well, his legs might come up a little bit on this, okay?
Okay.
Slide up, please. Just want to get into that S3. There. Gotcha. Walk it out. Different. Now it's different. Check out his dimples in his butt. They're moving now.
Oh.
Yes, you see?
Yeah.
Check it out. Mm-hmm. Mm-hmm. Keep your head up, please. Have a seat now. Let's rescope. Okay. Mm-hmm. So, C4, clear. Right now that's heat. There's no break, but now we got something here. Still heat. That's right. Now, from what I did, you should expect, let's go in extension. Tell us the difference to be in this position.
It feels easier to get into that position. I feel more flexible, I guess.
Yeah. So your homework with me is pretty simple. Water, walking, and ice. Water for you, gallon a day. Break it up however you want. Scoot forward, please. Feet together. Let's watch my thumbs again. Scoot forward one little. There you go. Put a little curve in there now. There you go. Open and close the knees. Left side only. Not bad. Right side only.
Well, it feels a lot different, actually.
Completely different.
It's not going crazy.
Left side only. Cool. Scoot back, sir. Bonus.
No.
Ears. Shoulders. Whoa. There you go. Stand up for me, please. Check the hands. Squeeze. Squeeze hard, please. Good. Squeeze. Scaffold. Squeeze. Squeeze. Alma. Let it go. Alma. There. Squeeze. Solid. Squeeze. Squeeze. There it is. Squeeze. There you go. On your back, sir. Face up. Face up. Ba-ba-da-ba. Ankles. Turn to your right side, please. Let's add the arch and the heel. There you go. Other side, please. Inferior navicular. Walk it out, sir. You're all set. Little different office visit, huh?
Yes.
What's the biggest difference for you in terms of the visit? It's not conventional, I get it.
For me, coming here, seeing what's wrong, and
Okay.
then I feel smooth.
What's that?
I feel smooth. Everything feels
Suave,
yeah. You just don't realize it. You just live with it.
right?
You just
It's
go about
like
your day and you just become used to it.
you compensate.
Yeah.
You know, it's like when the car's out of alignment and it just drives funny, and then some people just deal with it and get used to
Just
it,
get used to it.
and you just get used to it. But hopefully you learn it's not how it's supposed to be. Questions for me?
Could you do my job? Keep checking.
Absolutely.
It just clicks.
Have a seat. Sit back for me. Open slow. Open, open. Keep going. That's all you got? Close slowly. misleading. Slowly open. Open. Close. Open again. Close. Open again. You can go a little faster now. Open. Close. Open. Open. Slowly now. You got two issues, both of them. We need to set the EX though, here on the right, open all the way, close halfway. Okay, open. Now I'm going to use the board, the condyle block to hold stabilize the neck. Open, close, open, close, open, 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 slowly close. Open, close, open, open, close. There you go. Now you get a buff and polish. You want gloss? High gloss?
What is that?
The matte version, please.
That's the buff and polish. And if it doesn't hurt, tell us.
Nah, it feels great.
Wakes up scar tissue. Open and close now. Different?
Mm-hmm. I feel like it clicks.
Well, things will shift, okay?
Mhm.
And that will click a little, but as we're going through it, just bear with it, okay? It's been there for a minute.
Yeah.
Slowly open. Open. Last one I need to do. Open all the way, close halfway. Close. There. Open, close. Open, close. Open, close. Open, 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 close. There. Open, close. You're all set for today, sir.
All right.